Well, thank you very much, and good morning. I think also that during my talk will bleed into the afternoon, so I want to be the first person to say good afternoon today. My talk is a little bit different from the others that you've heard so far because I'll be sharing an overview of an evidence review that we've conducted that's much broader than today's topic, but we feel like it provides some interesting food for thought on some aspects of the way forward for NCD and HIV integration. Sorry. Oh, this. Okay. Sorry. Thanks. So some of you might know, but some of you might be unfamiliar with my organization's mission. Our mission at FHI 360 is to improve lives in lasting ways by advancing integrated and locally driven human development solutions. So why do we have that bit in there about integrated solutions, you might wonder? Well, we believe that by addressing multiple aspects of people's lives, there's the potential to exponentially increase our impact, the impact of our work. I think right now a lot of experts are starting to ask whether and when integrated approaches might be best for achieving some of the broader development goals. Especially right now, in the run-up to 2015, when the Millennium Development Goals are set to expire and we'll shift our focus to the next generation of global goals, conversations about the relationships between different development aims are becoming even more common. So I think you know that 3 out of the 8 MDGs were focused on health. So you had child health, maternal health, and HIV/AIDS and infectious diseases. And now it looks as if 1 out of the 12 next set of goals will be focused on health. So it's more all-encompassing, and I think right now is being referred to as ensuring healthy lives. And as a result, I think there's been some really interesting discussions taking place about this reorganization and the importance of remembering health's connection to some of these other goals. One example is that we've been working at FHI 360 for several years to explicitly articulate and promote the powerful impact that family planning has on other development outcomes outside of the health sector. On the flip side of that, just this month, the chief scientific officer at DFID made some remarks about suggesting the impact on health of the so-called non-health MDGs might actually have ended up being greater than the work being done within those 3 health-focused goals. So I think people are really trying to tease out these relationships and connections. The more that I've sort of participated in and listened to some of these discussions, I just wanted to draw attention to one important distinction. I think these linkages can be thought of in 2 ways. One is that there are natural ripple effects of doing something in a traditional single sector way where the benefits bleed over into other sectors. And then the other is separate because it's actually more focused on the proactive and deliberate merging of 2 fields to create an integrated program. So it's 2 ways to look at that, and my remarks today will focus on the latter. So just to explain that a little bit more clearly, I think we know that the underlying rationale for cross-sector approaches is supported by an extensive amount of data demonstrating linkages between key determinants of well-being. So we know, for example, that better health can lead to better education and vice versa. Much less clear, though, is how to achieve improved outcomes through strategically integrated programs that were deliberately designed to leverage those connections. So you can see here on our presentation that the tagline of my organization is the science of improving lives. So while we're acknowledging that there's these linkages between key sectors, we also deeply believe that it is of the utmost importance to look at what the current evidence base says about these multi-sector types of models as part of our own decision-making process. So 1.5 to 2 years ago, we sat down and asked ourselves, what do we really know about why or how well integrated programs work? We decided to do a literature review of the existing evidence base for interventions that integrated some select, traditionally parallel development sectors in the combinations that you see here. So I'm just going to provide a brief overview of how we approached the review, what we found, and what we think it means. First, just a quick caveat about the review itself. I'm sure that you're all familiar with systematic reviews, either conducting them or I'm sure using them. One thing that we had to confront at the very beginning of this process was that the very nature of the question we were asking wasn't necessarily that conducive to a traditional systematic review. We were trying to synthesize findings from development research spanning lots of sectors on a seemingly infinite number of intervention types and on measured outcomes, which is different than a more narrow specific question usually done in a systematic review. So we tried to be as rigorous as possible in our methodology, but I think interpreting what we found needs to be done with that in mind. First, we decided to define what we meant by an integrated development approach. I think if you ask 10 different people, you're going to get 10 different answers to that question. So for us, it was important to be very clear about what we were looking at. To be included, programs had to fall into one of the three categories that you see here. So a program had to deliver single sector activities that were intentionally meant to address outcomes in more than one sector, or deliver activities in more than one sector to specifically improve an outcome in one sector, or a combination of those, doing multi-sector activities meant to address outcomes in more than one sector. Programs weren't included in our review if there were assumed benefits across sectors, but they weren't designed that way. So a good example is I think we know that malaria campaigns can increase the years of schooling that some children get. But most malaria campaigns and programs aren't designed with that specifically in mind. So that was an example of what we were not looking at. So once we knew the type of integration we were looking for, we had to make some decisions about the scope. I think you can imagine that it would be difficult to identify evidence across all development sectors and in any combination. So we did a preliminary scan first to try to identify a feasible scope for the review, and we ended up with the 5 combinations you saw previously. So it was global health with education, with economic development, with both education and economic development together, nutrition, and the environment. So next we had to consider what kind of evidence we wanted to review, and I think given the rising priority of rigorous research designs and the ambiguity and sometimes lack of confidence surrounding results from less robust studies, we agreed to set our bar quite high. So we included research that had conclusions either from studies with a comparison or control group or via conclusions from some sort of research synthesis, typically a systematic review. After our search and 3-step screening process, we ended up with 59 articles representing 25 distinct intervention or program types. 47 of those were individual studies, and then 12 of those were some type of review. So within that relatively small set of studies that we identified that we felt were of high quality, this is just a quick snapshot of the kinds of development programs that were evaluated in those studies. So don't worry about reading the whole thing, it's just to give you an idea of the types of interventions that were found. We ended up grouping them into 25 intervention types. And as you can see, the largest number on the left column there addressed some element of combining health and education together. It's just important to note that we didn't predefine any of these and search for research on them. We used general sort of sector subject keywords and relied on only what was returned to us from those searches. So after analyzing the findings from those 59 studies, what we've ended up with is several promising multi-sectoral interventions, some with mixed findings, and then a couple that didn't have enough convincing evidence one way or the other. And I think that most of these were promising is a good thing and speaks for itself. But I also just wanted to mention that even the intervention models that we've classified as having mostly mixed results have valuable opportunities for application, because that mixed assignment actually comes from having at least one positive effect of the intervention on some outcomes or for some populations. So sometimes it was for either girls versus boys or for younger people. On the other hand, in a few cases, we found a surprising lack of evidence behind some interventions that I think are largely assumed to be effective by the development community in things like improving sanitary conditions for girls and combining HIV and food assistance programs. So I've also found it really helpful in trying to think about how we apply these results and looking at the quantity of the evidence that made up those are overarching categories of effectiveness. So what's important on this table are not the specific interventions, which are probably too small and hard to read, but the colors, which indicate the level of evidence that each intervention had in terms of the eligible studies. So that dark blue color means that there was a systematic review included in the analysis. The green color represents interventions that had findings from 3 or more studies, and then the light blue color means that that intervention turned up only 1 to 2 studies. So I felt like this was useful because the conclusions that we're drawing are a little bit different if you're thinking about it coming from a review or if, in some cases there was only 1 study. So moving on from the specific findings just for a minute, I think that, finding many integrated intervention models with promising evidence is really interesting. But remember that what I just showed you actually represents only the top 2 bars on this column. So really it was just a sliver of the existing evidence base and data that is out there on integrated programs. Having identified over 8,000 sources of information on integrated programs is really illustrative. I think that it means most governments and funders and program implementers are doing some form of multi-sector work. At the same time, the criteria that we set out for strong evidence about these programs reveals that far too few of them are actually being rigorously evaluated or reporting their impact. People tend to report their impact in things like case studies or client testimonials or beautifully produced long lists of things that were done, but not actually what the impact of all of those things eventually had. And I think this evidence gap makes it really difficult to ascertain what's been proven to work, what would likely work in other settings, and on a scale that's large enough to matter. So after our review, in general, I think our intervention-specific information doesn't necessarily offer up sufficient data that we could be confident to say, when you want to combine things, putting these 2 things together works and these 2 things doesn't. We did find some promising approaches, but at the same time, our findings, I think, revealed that effective integration is far from a given, considering the sort of lackluster findings or the absence of enough evaluation to know either way. But to me, what was perhaps even more interesting was what this exercise revealed about the state of multi-sectoral research. I ended up concluding that high-quality evidence on key integrated development interventions is inadequate. The body of evidence is just starting to evolve, and I don't think is necessarily keeping pace with the speed of the implementation of multi-sector efforts. Yet the demand for proven approaches is growing, and our resource base is shrinking. So I think it's our responsibility to be providing funders and policymakers and other decision makers with clear and scientifically accurate information about the effectiveness or lack thereof of programs. Next, I was left with some fairly pesky questions about the potential inadequacy of measuring conventional outcomes when looking at some of these more complex holistic development interventions. I think some of the multi-sector models that are emerging in the 21st century might require some different and more nuanced or sophisticated indicators for measurement than we've relied on in the past. So for example, if you want to know about integration, if adding 1 and 1 gets you more than 2, you might not necessarily be able to just take standard indicator list from Sector 1 and from Sector 2 and add them together. We might need indicators that are specifically designed to look at the impacts of an integrated approach. Related to that, comparison groups need to be really carefully selected when we're talking about multi-sector evaluations. There were a handful of studies in our review that evaluated a multi-sector intervention against single-sector ones, but the vast majority ended up doing an evaluation about a multi-sector approach versus no approach, which I think makes it really difficult to draw firm conclusions about whether it was the integrated nature of that program that actually worked. And finally, because my job description at FHI 360 is to make sure that research findings get used, I wanted to close by pointing out some of the uses that we see for what we do know and what we did learn from this review. And for today's purposes, we'll focus on the relevant topic at hand. Going back to my earlier remarks about the starting point for why we embarked on this review to begin with, based on some obvious close connections between some sectors, I think there's very clearly a deep rationale for exploring NCD integration because of the multitude of determinants inside health alone, but then also trade practices and urban planning, education and the environment, etc. However, understanding why integration of NCDs with HIV and other sectors is important and might be needed and makes sense is not the same as understanding how to make that happen. Those are two very different things. So I think the findings from our review point toward the critical importance of not only being bold and trying out some innovative strategies for bringing these two things together, but at the same time being very committed to carefully doing robust assessment and evaluation of those strategies through high quality and well-designed research. And of course, not stopping there, but then actually using the results of those evaluations to determine if and how the model might need to be adapted and to repeat that process until you have an effective approach ready to be taken to scale. So I wanted to thank you for listening on behalf of the entire evidence review team, two of whom we have sitting here in the front row. And thanks for your time.